Today, ADI has brought together ministers of health, leading experts to discuss the present state of global and national dementia policies, to share their frustrations and their solutions, and provide hope for a better future that we are striving for. We thank you all for joining us here today at this momentous event at a very crucial time. You are all here because we share in a belief that the world of tomorrow should be prepared and better equipped to support those with dementia. To build this world, we must once again galvanize our efforts and rededicate ourselves to a global plan. Thank you.
Thank you. I'm sure you will all join me to thank Princess Mona for being with us. It's so important to us, to our cause, to everything that we do. What you represent for us is a fantastic achievement for us to have gotten this far and to have you with us. I cannot thank you enough. And I cannot thank you enough for all of our panelists for coming from far away, all of them, some with severe jet lag, and be with us in this real moment of incredible historical importance for us. Now, of course, this event is about the launch of our report, the Plan to Impact report. We've been publishing this report now, it's in its 8th year, as initially as a way for us to monitor from the grassroots what was happening with the implementation of the plan. And of course, the governments could tell us that they were doing something, and we wanted to see what the people living in those countries, the people living with dementia in those countries were feeling. And so now the document is really a historical document as well that helps us chart year on year what was the sentiment about what that momentum was. And I'll tell you a bit more about that in a minute. But we start with a few slides. So if I can have my first slide, please. Maybe I've got to do it with that. ADI was established in 1984. We are the umbrella organization of 105 Alzheimer's and Dementia Associations around the world, and we represent our members in a number of fora, like the WHO. We publish the World Alzheimer's Report, and we promote, as you all know, the World Alzheimer's Month, and you all know because you all help us. Next slide. I just want to remind you briefly that we are a non-for-profit, so if you were thinking about donating something, you would be very welcome to do so, because we are very small and we do everything with very little. So thank you for being here with us, and for those of you that are our general sponsors, of which there are a few tonight with us, thank you for enabling us to do this. From Plan to Impact is an important report, but I just wanted you to hover for a second on this slide that we have been publishing for 10 years. These numbers continue to grow. So the estimates for the cost, I was at another event yesterday when somebody told me that the impact on their country for the very important thing they were doing was about 10 million pounds. And I was like, oh my God, we are talking about 1.3 trillion. It's a number that I cannot even envisage in my brain. And the estimated growth in number of people with dementia, as you can see, is for 139 million in 2050. But also, more recently, you will have noticed that ADI is talking about the top causes of mortality, and we are finding out more and more countries declaring, sadly, dementia, Alzheimer's as top causes of mortality, and currently 3 countries have it in the top cause, and that, again, sadly, is growing. So the key takeaways of the plan, there has been progress. I think this is the main thing I want to tell you. So today, this week at the WHO, there will be a debate on whether to extend the Global Dementia Action Plan. And we have been working together with one of the people that is on this panel, Conny, from 2 years ago, and with Tarun and with Catherine, that also are here for the extension of the plan. But The reason why it's so important to extend the plan is this, because this map is way redder than it was last year. There is progress. Progress is happening. If we don't approve the plan now, we are going to go backward, not forward. So it's absolutely critical to feel our community. And I haven't spoken to the many of you that are following us from home. Thank you for adding your voice to what we do. We hope that we'll hear your voice as well in the Q&A later. Some more of the takeaways from plan to impact. So the total number has grown, but as you can see, in some countries in the world, it's still not growing fast enough. Africa is still at 0, despite the enormous effort of some of our members. But some of the countries are showing definitely progress, and Europe continues to lead with 21 countries, which is absolutely wonderful. And 21 countries at the moment are developing national dementia plans. So this is why we need the plan extended. It's taken us this far to get these countries to do it. We don't want them to stop saying, oh, well, it doesn't matter anymore, so we are not going to do it. So this is why we are here today. And just the last graph, a new one that we've put together. So this is how the dementia plans have grown in the last 5 years. Okay, not massively, but they are growing. And this is why this is so critical now. And this is happening thanks to the effort of all of you here. Everybody, in one way or another, is really pushing the boat further. So thank you for everything that you are doing. Now, in order to access the report, for those of you at home that don't have access to a physical copy, there is plenty of physical copies that you can bring back with you when you exit the room. You can scan to access it. And now, let's move to my wonderful panel today. So I am joined some amazing people, and I really need to thank them for being with me. So as well as our ambassador, we also have His Excellence Dr. Firas Ibrahim Al-Hawari, who is joining us from the Ministry of Health in Jordan. We don't have yet, but he's on his way, His Excellency Budi Gunadi Sadikin, so we will give him space when he arrives later. We've got Maribel Campo, who is the General Director of the State Reference Center for Alzheimer's and Other Dementia of the Institute for the Elderly and Social Services of the Government of Spain. Thank you, Maribel. We have Yoshimasa Tosaka, this is the Director of Dementia Strategy, Health and Welfare Bureau for the Elderly in the Ministry of Health, Labor and Welfare of the Government of Japan. Thank you so much. Dr. Tarun Dua, who has been with me doing these panels for 8 years. She's an absolute hero. Thank you, Tarun. And Tarun is the unit head for the Brain Health Unit, World Health Organization. Conny Helder, the former Minister of Health, of Welfare and Sport of the Government of the Netherlands. Conny, thank you for being with us all the way. Dr. Joanne Pike, the President and CEO of the Alzheimer Association of the United States, by far our biggest country in the network of ADI, and a demonstration that, yes, we can be big, powerful organization if we put our mind to it. And then, last but not least, and the person that will be able to wrap it up a little bit for us, is Friederike de Meyer, who is a carer herself, but is also the chairwoman of the board of Demenzhilfe Austria. And thank you very much, Friederike, for being with us. So without further ado, and because we are running out of time very briefly, I am going to hand the floor to Dr. Firas Ibrahim Al-Hawari, who is going to speak on behalf of the government of Jordan about ideas for what is happening and what is going to happen with the National Dementia Plan for Jordan.
Thank you so much, Your Royal Highness, Excellencies, friends and colleagues. Thank you for this invitation to talk about a very, very important disease that's going to be one of the diseases of the century, I believe. For Jordan, we are already seeing the impact of such a disease. Just to give you an idea why this is going to impact Jordan significantly, for those who don't know, Jordan is about 11 million in population. 70% or 75% of these 11 million are below the age of 30. Only about 5.5% are older than 60. However, this number is going to change dramatically over the years, so much so that within the 15 years, the next 15 years, we're expecting to hit about 15% to be above the age of 60. We already have about 31,000 cases in Jordan. We're expecting that the number will go up to about maybe 50,000 cases. And the reason that Jordan is important, it's not because what's going to happen in Jordan, but because Jordan is actually a representative of the whole region. And if you look at the countries in the Middle East, they all have a similar demographic pyramid, if you may. So this is going to be a very challenging problem for the region. I believe right now, when we talk about dementia, and maybe specifically Alzheimer, we start using certain terms like prevention, early detection, and having worked at a cancer center for 16 years, it really reminds me a lot about a cancer as a disease. And it's also similar to cancer because, again, we are faced with difficulties in treatment, difficulties with, dealing with the caregivers that the disease will impact. So it is really a huge challenge. However, Jordan had started working on this. We are behind. If you look at the classification of the WHO, we stand at a stage 2D. We have plans. They are part of the national strategy of the elderly. However, we don't have a standalone plan that takes care of patients with dementia. With many barriers, I believe we need to work a lot, not just for preparing our healthcare system to deal with these patients, but also I'm worried. I'm very worried about the future, especially with the development of the new medications. Those medications, they seem to be effective, but at the same time, they're very expensive. And how are we going to do, and what are we going to tell our patients and their families? Why can't we provide these medications for them? Do we need to repeat the same cycle that we've went through with dealing with HIV, dealing with cancer patients, with the new novel immune therapy and targeted therapy? I think here a global action plan is extremely important so that we can start preparing for the day and make sure that we have equal treatment for all and available for all. I don't want to take too much because I know that we have a chance for questions later on. I'm going to stop here and leave it for the questions later. Thank you.
Thank you so much. So wonderful. Thanks. It's a joy to have you here. And thank you for the support, really and truly. And now we're going to have more questions. I remind everybody that is watching us at home that you can put your questions in the Q&A and you can introduce yourself in the chat line so we know who you are. So thank you for being here. I know there are over 900 people registered, so it's going to be wonderful to see what you have to say as well. Now, it is my pleasure to welcome His Excellency Budi Gunadi Sadikin, who is the Health Minister of Indonesia. Thank you so much for coming. It's a joy to have you with us. So Indonesia has had a dementia plan for a long time, and we are all here to hear what your next steps are with dementia plan in Indonesia. I think you have a microphone on the table, and I hope it's going to work.
Thank you. I supposed to come to this event last year, but I didn't come. So my deepest apology, because that is a sign of dementia. You keep forgetting. To be honest, Indonesia, we have 4.8 million babies every year. So if I'm not mistaken, it's number 3 in the world. So in terms of population, we rank number 4, but in terms of babies, we are more productive in the United States. So we have 4.8 million babies every year. If you want to see what is 4.8 million, it's like one Singapore every year, one Singapore every year. So many people think that we are a very young country, but I just checked the numbers from ChatGPT. Actually, 11.3% of our populations is elderly. It means, more than 30 million. And it's growing. I just became elderly last year because in Indonesia, elderly means 60 years above. So I just passed 60 years last year. So I'm 61 this year. So what happened when you reach 60 in Indonesia, they start giving you extra benefit. Free public transportation, free this, free that. One thing is good for the elderly, but it's also very stigmatizing. Like the government is telling me, Budi, you are old. So it is very depressing for me. That's why I decided to run my first marathon last year in Berlin Marathon and successfully finished it. So this year I will try to do Chicago Marathon and hopefully I can do it and finish the 6 major before 65. No, the reason why I'm doing it is not only one is a deniability that's saying that you are old 61, but I still want to run marathon. Just to share with you my experience, I passed the famous Indonesian artist with the age of 34 kilometers 35, but somebody, the old German grandma, passed me when kilometers 40, and when she reached the finish line, the grandchildren say, Grandma, happy 88 years old anniversary. So she ran faster than me, 80 years grandma. But the reason why it's important because in Indonesia, the statistic is 1.5 million dementia in 2021. That will goes to 4 million. And the cost of treating dementia from ALZI, the Indonesian Institute, is 8,500 per annum per capita, which is our GDP per capita is only 4,400. So the cost is double the average of GDP per capita. So it is very, very costly. And as a non-medical person, because I'm a banker for 30 years, I'm a nuclear physicist by training. This is the first time in Indonesia the health minister is not a medical doctor. So since my title is Minister of Health, I believe my job is to keep people healthy, not to cure sick people. Maybe if my job is to cure sick people, I will change my title Ministry of Sickness rather than Minister of Health. So what I heard, if you can reduce the chance or the possibility to stay healthy by the data that I receive, by make sure that you don't have hearing loss, and you have the low LDL level. So everything about cardiovascular diseases, you can train that. It will be very, very good. So that is the reason why Indonesia now is doing massive screening programs this year, starting in February. 280 million Indonesians will be screened every year. And now it reached 6 million after 2.5 months, and the daily run rate is about 200,000 per day. And I'm very surprised that hypertension is 44%. 44% hypertension, 14% blood sugar. And then when I check with this one, the cholesterol level is around 12%, high cholesterol level. We didn't check the LDL yet because it is very important for us. So this is the reason why I'm very worried. This is the first time I know that the dementia wave is coming to hit us very, very soon. And rather than, curing when you are dementia already, I would like to make sure that no hearing loss, low LDL level, and also make sure that the social isolations for people when you're getting older is not there. So this is the thing that we would like to do, and hopefully the Indonesian that is getting older after me can live not only longer, average life is 74, but our healthy life is 62. So it's not only live longer, but also live healthy. And I do hope all of you that's sitting there or sitting here, all of us will reach, the average global, I think is 82. Hopefully you can live up to 90 and healthy. So when you have to die, you die without any sickness and without dementia. God call you and you go to God, without dementia. Thank you.
Thank you, Your Excellency. And thank you for also tackling one of the issues that many countries, you were sort of touching on that as well. So not all countries have the resources to tackle the whole spectrum together. And it's important that countries start from somewhere. And it's an interesting start to start with prevention, because it enables you to do something that will bring population to a healthy point. Obviously, from our point of view, care is also equally as important, but sometimes that is more affordable in the settings of countries that can afford it, although that is also becoming unaffordable, as I'm sure that some of our speakers will talk about later. So I also would like to acknowledge here virtually D.Y. Suharia, who is trying to get you here for many years. So it's lovely that you are with us today. So thank you very much. Now we'll continue with our panelists, and our next speaker is Maribel Campo. So Maribel, thank you for being with us, and thank you to Jesus Rodrigo, our board member, who is with us today, who has persuaded you to come here, but I understand there's not been taking a lot of persuasion. You've been delighted. So please give us a point of view from Spain, which is a country, by the way, that still does not have a national dementia plan. So that's why we're working towards it. Thank you.
Appreciate to radiate the invitation on behalf of the government of Spain, and especially from our director, Maite Sancho. And I'm glad to share with Princess and all the high-level panelists. And thanks to all in here and online. Well, Spain has, in Europe, the highest expectancy of life. The highest life expectancy with 84 years. And according to the Lancet, by 2040, we're going to catch up Japan with 85. So while population, when population aging is an achievement, it also implies that dementia prevalence is high. So the number of people living with dementia in Spain is over 800,000 in a population of 48 million. But people implied these 3.5 million people who impact daily with it. So Spanish Society of Neurology estimates is close to 15% of people, the population over 65. And when Paola said, do we need an action plan? Sure, of course, we need it. Is it evident that when there is an urgent need to extend it to provide a comprehensive response, which is 7 areas, and it's important to ensure the rights, the quality of life of those affected. Well, Spain, the national plan expired in 2023. And although COVID pandemic highlighted the achievement of most of its objectives, several actions were successfully carried out. But now is the time for Spain to push forward with social and healthcare policies that support the social, emotional, and economic impact for care partners. Well, because care, we really need from the government that care should be a collective responsibility, not the family responsibility only, a collective responsibility. About barriers, in Spain have a very barrier, that is that most of the carers report that receive little or no information on key aspects of the disease, and so a high level of awareness about social and healthcare resources. Some solutions that it's important to highlight that the efforts for the Institute of the Elderly and Social Services and its state reference center supporting 22 third sector initiatives, and in addition, specialist services, research into non-pharmacological therapies, training to more than 300 million people, 300,000 people, and more than 500 families. From the Institute, from the State Secretariat, and from the Ministry of Social Rights, because you know that the plan was from Social Rights and from Health Ministry. Actually, we are also developing national strategies, studies, and some actions related with people with dementia in which strategies there is a special part for people with dementia, such, for example, including the strategy for a new model of community-based care, the desinstitutionalization process from 2024 to 2030 with 2,000 million that is the most amount than ever our country has on a plan or a strategy like this. We have still the reform of the care model, dependency and disability laws, the adaptation of cognitive simulation therapy that most of countries have, and the upcoming Spanish strategy for reducing loneliness. To conclude, I would like to share, I just joined last week the scientific coordination team of the National Strategy on Neurodegenerative Diseases of the Spanish National Health System from a social perspective, but it is a challenge, this strategy, because this strategy sets the framework where for develop coordinated plans and programs that we need, the roadmaps to improve the quality of life of people living with dementia and the care partners. This is also a key moment. It's a key moment for the global plan, as a key moment, a pivotal moment in Spain. So we are looking forward the extension of the Global Action Plan and the publication of the ADA World. Yes, we are waiting for the World Alzheimer Report 2025, the Rehabilitation one, because they help to change the expectations and to change the plans that we are looking for. We always move forward in collaboration with CEAFA, because the Spanish Alzheimer's Confederation, we need them. We try, we have just support in the Spanish Senate with their demand Pact for Memory. So thank you, Jesus, for your support, and thank you, Paola, for the opportunity to ADA and all the people that have come today. Thanks.
Muchas gracias, Maribel. Muchas gracias por llegar aquí y por ese fantástico discurso en inglés también.
Sorry.
Thank you. So thank you for being here, for relating this to us. Thank you also for mentioning an important topic that is becoming increasingly critical for the implementation of the plans, but also critical as new treatments are coming into fruition, and as your Excellency said just now, they seem to be effective, and so we all want them, but there is a massive need here, and it's becoming greater and greater the need for education, because the report in last year, the World Alzheimer's report, reminded us that 67% of medical professionals still don't know that dementia is a disease, and this is a massive issue, and this point about training, at some point we'll have to sort of really work into it much harder. Now we are moving on, and I remind our speakers to be kind of trying to stick to their 3 minutes, although I know this is fantastic and we got time for questions, so we're doing quite well actually. So the next speaker that I'm going to invite is Yoshimasa Tosaka from the government of Japan. Thank you very much for coming in, and again speaking English. That is very great of you. The government of Japan, I should say, have been on these panels in many ways, in many forms, in many ways during the year. Have always been one of our greatest supporters. So, arigato.
Merci beaucoup. I prepared some presentation slides. So.
Yes. Can enable you if you press very hard.
It is a great honor to speak on behalf of Ministry of Health, Labor and Welfare of Japan. Japan is one of the most rapidly aging countries in the world. In response, we are striving to build a society where people living with dementia can preserve their dignity and live with hope. In 2024, we reached a major milestone. New dementia treatments began nationwide, and the Dementia Basic Law was enacted, followed by the National Dementia Basic Plan. Today, I'll highlight 2 key pillars of our strategy: promotion of innovation and dementia-friendly communities. Our initiatives are also being showcased at Expo 2025 in Osaka. If you have a chance to visit, I warmly invite you to the Japan Pavilion. Considering the current exchange rate and prices, it might be an especially good time to trip to Japan. According to 2022 survey, 12% of older adults had dementia and 15% had mild cognitive impairment. As the number of people aged 85 and older continues to grow, it is estimated that 1 in 3 older adults in Japan may be living with dementia or at risk by 2060. We must recognize that anyone may develop dementia and begin to see it as a shared concern. The Dementia Basic Law sets forth the principles of realizing a dementia-inclusive society. It requires that policies reflect the voices of people with dementia and their families. The National Dementia Basic Plan reflects this principle, incorporating input from people with dementia and their families. Let me now turn to the first pillar, promotion of innovation. Japan is advancing research and development from basic science to clinical application, aimed at understanding the causes of dementia, developing effective treatments, and establishing technologies for early diagnosis and intervention. In 2023, lecanemab, the first anti-amyloid drug, was approved. Unlike conventional symptomatic treatments, it targets the cause of Alzheimer's disease and has been shown to slow progression by 27% over 18 months. As of October 2024, over 8,000 patients in Japan had received lecanemab at over 600 certified facilities, supported by a nationwide network of specialists and physicians. However, these treatments are limited to early-stage Alzheimer's disease. In other words, the number of patients who may benefit from these treatments remains limited. Therefore, while promoting early diagnosis is important, we must also ensure that the people who cannot benefit from these treatments do not fall by the wayside. We advance efforts to build a society where people can live with hope and dignity even after diagnosis of dementia. This leads to our second pillar, dementia-friendly communities. Under our national plan, local governments are developing strategies tailored to their communities. Dementia peer support is especially important. People newly diagnosed with dementia often experience fear and isolation. Meeting others who share similar experiences can bring emotional relief and a renewed sense of hope for the future. It is also essential for local government to listen to the voices of people living with dementia. In some cities, authorities hold dementia people meetings to directly incorporate their perspectives into their policy planning process. In other cities, welfare provider operates community dining space where people with dementia are not only welcome, but help manage the space, ensuring that they remain engaged and valued members of the community. We are advancing these proactive efforts by local governments. Japan's efforts align with the WHO Global Action Plan. We are committed to sharing our experiences and strengthening international collaboration. We hope Japan's initiatives will contribute to dementia strategies in your countries. Thank you very much.
Thank you. Thank you also for illustrating how you're bridging the treatments with the care. And again, Japan has always been at the forefront of looking after people living with dementia and creating dementia-friendly communities. So thank you for that update. Now, again, I'll tell the panelists we've got to hurry a little bit, otherwise we'll be short for questions at the end. So my next speaker is Conny, who is the former Minister of Health of the Netherlands, but has also been involved in dementia for a long time. Conny, the floor is yours.
Yes, thank you very much. Paola. And I've been involved in a long time because before I became a minister, I was a CEO in elderly care and dementia care. From the point of view from the Netherlands, we have a strategy already in place for about 20 years now. And it was very focused on the last stage of dementia. And also in the Netherlands, when you're 60 plus, you're considered old. You were considered old. And it was very normal to be placed and to go and live in a care community, for instance. That was after the Second World War. People nowadays don't want to live in care communities anymore. So we only have nursing homes in place for the last stage of dementia. And what I worked on before I became a minister, and what we are working on still in the Netherlands, is to make sure that even in last stage dementia, you can still make sure that people can be much more functional if you treat them the right way, if you give them self-reliance and more dignity, and you activate them. It's possible to not go and live in the nursing home. You don't need it, and they can still live in the home environment. And that's something of a shift in the Netherlands. The other thing is, of course, what already was mentioned, the new treatments and the new diagnostic tools. I do recognize the barriers of the cost effectiveness, of course. I'm also a chair to an organization for future affordable treatments in the Netherlands, and I work on regenerative medicine also. And in both those fields, we have the same problems. So I think in the dementia field, we need to cooperate with those fields and see if we can alter, for instance, the way that we do the clinical trials, and we can alter altogether the cost picture when it comes to the new personalized treatments. It's not all bad news, I think. I'm looking forward to diagnostic tools that we don't need a PET scan to diagnose people. We don't diagnose as much people as we would like in the Netherlands with Alzheimer, and I think if we can do it earlier, it's also, of course, an ethical burden, but it also will give patients response time for themselves to think about what they want to do in their life. And I also wonder, just like the Minister of Jordan said, we didn't bother as much when it came to cancer. It took a long time to have those treatments in place. The same with HIV. But also look at the COVID vaccines. We were there in 11 months worldwide to have a vaccine ready. Not for everybody, I'm sorry to say, but it was there. So I think working on that on a global scale is absolutely adamant. And I do believe that pathways should be combined when it comes to new treatments also with care. New care models much more in the home environment and much earlier in life. And because of that, I organized in 2023 a summit. It's called Defeating Dementia. It wasn't called Living with Dementia. Defeating Dementia, because I think we do need those care models for the persons having dementia already. We do need earlier interventions for the people who are developing dementia. As we are sitting here, it takes 10 to 20 years, so there's a huge amount of people already in the process. But I think if we speed up and have those disease-modifying treatments and diagnose people very early on, we can still stop the wave that is coming towards us. So I'd like to speed it up. And I'm always, you know me, Paola, I'm always aiming for the moon. Why not? Because I always say, I can't explain outside of this room that we're not speeding up. When everybody was confined to their hotel room or to their house in COVID, we sped up. Let's do the same for Alzheimer's.
Conny, thank you very much. We need more people to sort of aim for the moon, don't we? And it's lovely what you just said about everything that also has been done in the Netherlands, but also interestingly about the change of perception. What we considered to be older before is certainly not what happened now. Now that 61-year-olds go on marathon, you make me ashamed. I mean, like thinking I should be going on a marathon now. It's terrible. I thought I was past it, but clearly not. So thank you very much. I'll ask again the panelists to sort of make sure that we are in the time. And I'll ask everybody at home, if you got questions, please, this is the time to put them in the Q&A, because we'll be quite fast with the Q&A next. And now is my joy and pleasure to hand the floor to my companion of crime here for so many years, Dr. Tarun Dua from the WHO.
Hello, Your Royal Highness, Princess Muna, Al-Hussein, Your Excellency Al-Hawari, Your Excellency Dr. Sadikin, esteemed panelists, and all protocol observed, dear colleagues and friends. It's my pleasure to join Paola for this launch of the 8th Plan to Impact report, and it has been credible. Since 8 years, the plan has been launched, and ADI has come together to celebrate the successes, to push us to aim for the moon. So thank you very much, ADI, for doing it all these years. A lot has been achieved. I think we should be congratulating ourselves that we have done a lot, but still a lot needs to be done. So a couple of things, when we did the first baseline monitoring of the action plan, and only 62 countries responded. So out of 194 member states, only 62 countries bothered to respond. So that was the prioritization of dementia. We went back last year to the countries to tell us what are the things, how the things are happening. At least 100 countries came back. So there is an impact that's happening. And Paola talked a lot, in terms of the role the plans that play. And Your Excellency, Dr. Al-Hawari, we have seen in the data that has been provided that if you have a plan, you are more likely to meet other key dementia targets. So that's a good standing point for having a plan. It can be a standalone plan. It can be an integrated plan. The most important thing is that you need to have a budget line. You need to have resources to implement and take it forward. And let's not forget everybody. And I think you mentioned COVID, and it brings to my mind also the humanitarian emergencies, the crisis that we are facing, and not to forget the refugees. And we actually published recently a report on how, specifically on the health of refugee and migrants and for people with dementia. So in a sense, we need to tackle all the inequities that are existing in this field. In terms of many of the important things, Your Excellency, Dr. Sadikin, physical activity is actually a protective factor for dementia. So maybe you took a few years in terms of preventing the dementia by running marathon and doing this. And this is something that as dementia risk reduction guidelines that as WHO we are updating this year, we are encouraging all countries to take it forward. And because what we know is there are so many of the cases of dementia that can be prevented, and we need to do that. Let's not forget that together with taking care of people living with dementia, we need to support the carers, and we'll hear later. And we have an iSupport program being implemented in over 60 countries, and more than 30,000 people have been enrolled, but it needs to be scaled up because by the end of the decade, 80 million people will be living with dementia. And one person with dementia means 3 carers. So we are definitely not on scale. We are also need to, we heard about the new diagnostics, new treatment, and we have a dementia research blueprint. And what it means is we need to have research happening in all parts of the world. 60% of dementia is in low and middle income countries. And we need to see that more and more evidence needs to come for that. The executive board recognized this, and they asked that action plan should be extended for next 6 years. World Health Assembly is going to discuss this week, and we are optimistic that we need to take this momentum to ensure that dementia gets all the attention that deserves. And we need to work synergistically with all the programs. And one program that comes to my mind is the NCD program. And we have, as WHO Secretariat in the Zero Political Declaration on to say that dementia should be part of all the strategies of NCDs and mental health that countries are implementing. So So thanks everybody for all the work that has been happening in making this together. We need to leave no one behind. And thanks, Paola, thanks ADI for all the wonderful work that you do.
Thank you, Tarun. Thank you so much. Probably now the time to also thank the billions of people behind ADI and all the work that we do, but none more so than Chris Lynch, Jane Sibora, Mega Anderson, who are with me today. Louis Arthurton has been trying to read a statement at the Assembly for 3 days now, staying there until late, still failing, but we will succeed. And Wally Wang, who is receiving a very well-deserved award at the WHA on Friday, so well done, Wally. And the millions of you there helping all the time. Wendy Widener and Chloe Benoist at home, who are the principal author of the report as well, let's not forget. So thank you, all the team at ADI has really been fantastic with our board in trying to get all of this done. So congratulations to all of you. Now, last but not least, we've got two important contributions to this. I still don't see any questions, so do send us the questions. Next one to speak is Dr. Joanne Pike, and Joanne is the CEO of the US Alzheimer Association. Now, if there is an association that can tell us how it's done, in particular with advocacy with the government to try and get innovation on the road, that's Joanne. So Joanne, the floor is yours.
Thank you, Paola, and thank you for the invitation to be here. As you mentioned, the ADI was started in 1984, and the Alzheimer's Association is a proud part of the roots of ADI, and certainly the progress that we're seeing here today and hopefully this week will be a big testament to the years of work that you've been doing on this. So the Alzheimer's Association has certainly, in its long history, started as a grassroots organization, but has championed the need for public policy as a critical element of the work that we do. And that public policy has resulted in several key wins in the US that I want to highlight as part of this, because I think it builds on what you can achieve in a country, but also what we still need to continue to protect and move forward. So our national plan was part of the requirement that came out of what's called the National Alzheimer's Project Act that was passed in 2011 in the United States. Our first national plan was required, as I mentioned, and was issued in 2012. That really ushered in a new era of the ways that we think about, the ways we fund, the ways that we consider public health in the United States around dementia and Alzheimer's broadly. One of the goals of that first national plan was to effectively treat or prevent Alzheimer's by 2025, and here we are. Prior to that National Alzheimer's Project Act, though, the United States did not have a comprehensive national plan. And that the NAPA, National Alzheimer's Project Act, really paved the way for several successes that we then began to build on within the United States, including unprecedented increases in the US government funding for research, along with a public health infrastructure to support Alzheimer's and dementia. That public health infrastructure, along with funding for care, was part of building a broader quality of life movement within the US. But let's focus on research for just a second. Back in 2010, the United States, for every dollar the US spent on investing in Alzheimer's research, it was actually spending nearly $300 on caring for Alzheimer's. So for $1 invested in research, they were spending $300 in care. And that investment certainly was upside down within the US at that time. It was not commensurate with the problem that we were seeing. At the time of the first national plan within the US government was investing $448 million per year in research for Alzheimer's and dementia. Now, in 2025, that figure is $3.8 billion per year. So the growth certainly has been able to create faster routes for scientists. It has created innovation pathways on treatment, diagnostics, risk reduction models, and certainly that progress has resulted in where we are today with a new era of treatment for Alzheimer's in the US and certainly globally. Now, additionally to that 3.8 billion in research dollars annually, we've also been able to, through our grassroots network, advocate for and have now $40 million invested in the public health infrastructure, along with a new care model that is being implemented through our Medicare program that really looks at comprehensive care for both caregivers and someone who is living with dementia. That is an 8-year pilot called GUIDE, and we are all very hopeful that we're able to show that providing quality care results not just in better service and better care for individuals, but also reduces cost and hospitalizations long term. Now, to end really quickly, last fall, the national plan was up for renewal, and we worked diligently with our grassroots network to extend the National Alzheimer's Project Act for another 5 years, and certainly will continue with the priorities around research, care, public health, and services. Thank you.
Thank you very much, Joanne, for telling us what can be achieved if you really put yourself to it. And it's amazing, and you're on a great trajectory, and we hope for more success. And it's a difficult time for all of us here, but it's great to know that you are continuing the work that is leading, in particular in some specific aspects. And so thank you. Now, I think one of our panelists needs to leave. So I want to give the opportunity, if anyone needs to leave, I got a message, but maybe not. That's great. Thank you for staying, everybody. It's with the greatest joy that I am handing over the floor to Frederick, who is going to tell her why are we here today from her viewpoint. Thank you, Frederick. The floor is yours.
Yes, good evening, everyone. I'm very grateful to speak not only as the chairwoman of our Austrian umbrella association for dementia self-help, Demenz Selbsthilfe Austria, but as a wife and as an informal carer, and also as a witness what profound impact this dementia has not only on the person who is diagnosed, but on his entire family or his caring surrounding. My husband Christian was first diagnosed 2016 with a suspicion on dementia. And this because I went to see the family doctor, and I dared to speak out what I observed the years before. So from 2013 to 2016, that my husband's personality was changing and that he was forgetting things. So the family doctor gave me, I was there alone, the address of a psychiatrist. But no, I was there with this address, but I had to speak to my husband. And I have been putting this out for 3 years to speak to him and to speak about my observations, because I thought it was very overtapping to confront him with what I have been observing. But finally, okay, I did this. We went to see a psychiatrist, and there was this suspicion of dementia. My husband, Christian, was a very successful civil engineer on international sites. We've been living all over the world with 3 children, and he loved his job. He was really dedicated to his job. And so he continued doing this, and he went to work in Toronto and in London, and the last site was in Copenhagen. And then one day, my daughter and me, we said, we have to make him stop. Because we were realizing, or we could see throughout the years, that what we thought was a burnout. I had this word dementia in my head, but I was hoping, still hoping, it's only a burnout. So to get clearness, I insisted on a PET scan. And I know this is the most expensive way to get the diagnosis. And there it was, presumed young onset Alzheimer. And you get this diagnosis and you get a warm handshake, and that's it. You're left alone until today. I'm speaking from 2019, but until today, and I think this is the way it is in many, many countries, and that you get the diagnosis, but you don't get a treatment pathway. Yeah. For us, the world turned upside down, as you can imagine, and you have often heard here in this room, the world turns upside down. And my husband was really very, very depressed, because he was very active before, and he was defining himself through the work, as many men do. And yes. And suddenly, from one day to the other, he had to leave his job, and he was left behind with nothing. He lost his purpose also to be here, and he would say every day, and I told it to Chris, I feel kicked out of society. Yeah, that was really hard to hear for quite a long time. I myself was, of course, I was helpless. I felt helpless, but I had to be strong. And with the young onset Alzheimer, there is a lot of administrational stuff you have to do, fill in all these papers. So I did this. And what I learned maybe from living abroad and moving around a lot is I created a network. This, I think, is a very important thing. But I was able to do this. I know many people are not able to do this because they are not used to do this. So I built a network, and I have to look on my paper. Yes, I had a job. I had to reduce my working hours. I have been working full time. I reduced my hours. Then I quit my former job as a teacher, and I'm now part-time working for a dementia network in Styria, and I'm a dementia activist as well. And yes, this is what happened to me. Today, Christian, and I mean also today, he is attending a daycare center we have back in our town in Graz for people with dementia. We have 3 daycare centers for people with dementia in the second biggest city of Austria, but that it is. If you're living on the countryside, there's nothing. Yeah, so, yeah. And since a couple of weeks, we have a carer couple who is staying with us. So when somebody was telling it needs 3 carers for one, yes, it's true. They're staying with us, and they are staying with us for 2 weeks a month. But still, it is there is a huge burden on families like us. Even I know that we are in a good position. I know this, but the burden is the emotional toll, and the physical exhaustion, and the financial strain. My husband was 54 when he had to leave his job, and with 3 children in midst of their studies. So, but we are not alone with this. I know there are many, many families in the world facing the same thing. And I think, therefore, the Global Action Plan is so important, because it shows that there should be more help for families and for the people with dementia. I must say we have a national strategy plan in Austria since more than 10 years. But as we say, paper is patient. And we would like to see that there are more there's more personal help. And then this, I think, as far as I read, is also a financial thing. If I would have gotten more help in the beginning, I should not have reduced my hours, my working hours. So I know that I'm speaking from a part of the world which is privileged. And as we have been also living in other parts of the world, I must say that it is very important that we all help together, and this will be a global societal challenge that we have to, well, we are facing. Thank you very much.
Thank you, Frederica, for sharing your important story with us and remind us the other side of this societal cost and why we are doing what we're doing, because there is so many people that are in a terrible position. And I have to say, you also raised young onset dementia. There are people in this room that work on young onset dementia. That is becoming increasingly a massive issue that is even bringing more cost to our society, and we need to resolve it. Now, I thank everybody for patiently staying here. This is the moment of the questions. Now, we've had some technical issues with the questions, but as you know, we are used to try and resolve complicated issues on the go. But first and foremost, I think there may be someone representing Slovenia in this room. Yes, thank you very much. Please, we were supposed to have Slovenia with us on the panel. A number of things have happened that probably you've read about in the paper. But nevertheless, we wanted to give Slovenia a chance because they have been doing an excellent job with their dementia plan. Please.
Yes, thank you. I just wanted to say that it was prepared together with my Professor Shubhada, my dear friend and colleague, and he is not unfortunately here. But it is very interesting discussion, and I don't want to repeat some things already told, but is about global action plan. In fact, the extension of global action plan is, I would tell, 99.9, almost 100%, because the discussion already happened in executive board, and Slovakia, as just ending executive board member, also was vocal for the extension, similar as many other countries. So World Assembly is sort of a governing body that will confirm this. So I would be quite proud that that it is sort of already done. And yes, about these challenges that yes, there are many challenges, but also many good things happening. Also, we are seeing these cases here. From Slovak experience, Slovakia is promoting non-pharmacological interventions, both for prevention and also as part of integrative care. We emphasize lifestyle risk reduction strategies and accessible therapies and influence patients' quality of life. Yes, we confirm our government office also confirmed that there are substantial indirect costs affecting families and wider economy, and dementia has been identified as one of the most costly, most economically burdensome disease in Slovakia. So this is like argument for these prevention activities. There is a very good support of family, but also this is in capital, in Bratislava, but there are some centers also regionally. And this we see as a cornerstone. The Slovak Alzheimer Society and the Memory Center offer structured training and educational seminars to better equip family members in caring for their loved ones. Supporting care means supporting the entire care ecosystem around dementia patients. Key challenge, I don't know if it was mentioned here, but key challenge we see the lack of comprehensive pension level data across health and social sector. because this information gap, bridging this information gap is critical for evidence-based policy, resource allocation, and the delivery of integrated services. Without, in fact, accurate data, we risk designing systems that do not reflect the real needs of people with dementia. And finally, of course, the research in dementia. Slovakia is proud of its contributions to global dementia research. The Institute of Neuroimmunology, in collaboration with our biotech sector, is developing a first-in-class tau vaccine for Alzheimer's disease, a promising frontier in neurodegenerative treatment and a testament to the innovation potential of smaller countries. And also our Professor Novak from this institute received the WHO prize in 2016. So we see that again this year there will be another personalities to receive. So this we are happy that this.
Thank you, Helena. I'm sorry, I forgot to cut you short because I've got so many questions coming in now.
Yeah, so comments also. I would prefer the comments from panel to solve these challenges.
Thank you, Helena. But we do need to sort of put a number of questions. And I've got one in particular here, which I think is for our excellencies, for both of you, so Jordan and for Indonesia. Given the intersection between dementia and other non-communicable diseases, and you know that we've been doing a lot of work on NCDs this year, how can dementia be better integrated into broader non-communicable diseases frameworks at the national and regional level to avoid the fragmentation in health responses? So many NCDs, how do we bring it together rather than fragmenting it? Would you like to go first?
Definitely. And I think this is an extremely important question. And the answer would be is through integrating dementia within the primary healthcare system so that when patients are faced within their primary healthcare clinics, we can do the early detection, we can do the prevention, because as you know, all the risk factors, we talk about age, but we also need to talk about other things such as tobacco, obesity, diabetes, hypertension. So if you look at all these factors, they are part and a major component of any primary healthcare clinic. And I think family physicians must spearhead these efforts. And that's why we need to make sure that we are educating them to pick up the early signs and symptoms, and think of this as a disease just like any other disease with the components there: prevention, early detection, diagnosis and treatment, and palliative care. This is the spectrum that we need to work on and ensure that it is available for all our patients.
Thank you so much. What a good question, bringing us back to education. Minister Sadikin.
In Indonesia, when I joined, how we attack the healthcare issue is by diseases. So it's very focused on diseases rather focused on the patient itself. So first, we reorganize the ministry so it focuses on the patients. Somebody that old can have many diseases. But it's very typical, I believe also in many international organizations, the approach is diseases-centric. We change that to patient-centric. So that is reflected again, like Your Excellency, in the primary care situations. So instead of approaching by diseases, we are approaching by the patient-centric model. And then as I'm a very, believe in preventions, what we do in non-communicable diseases, we do a lot of preventing the diseases to come, especially for the elderly. Like example, cardiovascular activity should be there, early screening should be there, and of course also physical and brain activity should be there. In terms of treatment, I have to admit Indonesia is not as advanced as Japan because we don't have aging population as Japan, but this gives me inspiration that we need also to prepare the treatment for the elderly as a package that is very patient-centric. instead of disease-centric.
So we are succeeding here, inspiring each other. Thank you very much. We hope to see you all in Lyon in 2026 to get more inspiration together. Thank you, Minister Sadikin. One question for Tarun. So 30 seconds now for the reply, guys, because we are running. Can you tell us more about what initiatives WHO is introducing globally to improve early diagnosis of cognitive impairment and dementia prevention? This would require half an hour, but please, Tarun.
Yeah. So building on, in terms of dementia prevention, we have dementia risk reduction guidelines. We are updating with the recent evidence this year, something to watch out the space end of 2025. And it will be important that we roll it out in all the countries across the world so that next year it is not 100 more than that. We have our guidelines, MHGAP guidelines, which are actually for the primary healthcare system. These have been used in more than 100 countries. I think we need to scale them up across the whole world so that dementia management can be done in the primary healthcare system. So these are the two tools available from WHO that we encourage all ministries to take it forward.
I can tell you that was a miracle. Thank you so much, Tarun. Question for the Netherlands. So, Conny, this is for you. Could you please tell us what therapies are being explored in the country for those living with dementia? So they're looking at therapies. I presume biomarker and perhaps diagnosis maybe more.
We are developing like bio-based blood markers. That's something we're working on. And we're a little bit lagging behind when it comes to the new treatments and making sure that are available. And the other thing we are working on when it comes to, well, you could call it the treatment, is more the societal innovative treatments that we have, the way that we treat people with dementia and make sure they're a valued member of society. And that, I think, is one of the things we need to fight also. That's the stigma, because we have an elaborate system of primary care, for instance, but it's very difficult for people with dementia to come to the family doctor and to explain that they might have memory problems. So also fighting the stigma that it is not a normal part of aging, but it's a disease. That is something we are working on. And I think the development of the new treatments and the diagnostic tools helps that discussion, helps to change the frame to more disease-oriented. And that must be a patient-oriented, person-oriented.
Thanks so much for mentioning patient centricity. This is one of our linchpins. But yes, that's a very good point. Lots of research also in non-pharmacological intervention here is going on. Now, one for Joanne. Again, 30 seconds is going to be impossible. Considering the funding has been a persistent barrier in many countries, what innovative financing or partnership models have you seen work for dementia policy, for policy implementation, that could be scaled or adapted to other regions?
I think one of the key pieces that we've been working on in the U.S. that I think has a significant amount of validity in many places throughout the world is really thinking about the public health system and how do you partner within the public health system to think about diagnostic care, especially person-centered care, as you mentioned, and how do you include the caregiver within that? Public health systems are driven from both nationwide levels down to local. And Alzheimer's and dementia and any chronic condition, any NCD, ultimately is a locally driven, delivered care issue. And so finding where care is delivered, public health is a great place to start, and partnering with that care delivery model is where I would always begin.
Thank you very much, Joanna. You're going to have the last word here because I am realizing that we've run out of time. But we are on time, which is incredible, considering the wealth of experience and input we have been giving by this panel. I need to thank all of you and respecting protocol, Your Royal Highness for being with us, Your Excellencies for being with us, colleagues, government representatives, friends. I cannot thank you enough. All of you here in this room are working so hard. I hope everybody at home enjoyed the debate. We are very happy to have more questions, of course. As usual, you can put more questions that we may have not had the time to reply to into our system. Now, I will ask everybody to bear with us a second as we have to do a picture with the panel for future from plan to impact reports. So thank you for coming, and thank you everybody at home for being with us and for your wonderful question. Thank you. Merci beaucoup.